Good morning, everybody. I am recording this session so it can be shared on the non-public school health and security website for you to share with your colleagues or refer to later on if you have any questions or want a refresher on program requirements. I assume you're all here because you represent a non-public school and you're eligible for the health and security grant that was released about a week ago or so. My name is Nicole Obregon. I'm the Special Fiscal Programs Administrator. I oversee several programs, many of which involve some of you in non-public schools. And I have my colleague on the line as well, Robert Wankowitz. He is the Boost Program Manager, and he is here to record any questions you have. Following this meeting, a list of frequently asked questions will be shared on the webpage. Put a link to the webpage in the chat box, but I'm going to put it there again for anyone who just logged on. So today I'll walk through the grant information guide, the gig, introduce you to the website, go through the online application, and talk about what the invoicing will look like for this program. So this is what the non-public school health and security program webpage looks like. It has all the information you'll need to understand the requirements and the timeline for the program. So this should be your first stop for information. We try to keep it up to date as developments happen. On the left-hand side, there are a list of resources, the grant information guide, which we'll go over right now, a link to the online application, a list of non-public school allocations, that's here as well. It's also in the grant information guide, but it's a separate document too. This is a list of frequently asked questions that came out from the session we had last week. Someone asked, can we use the funding for a feeding technician for children of special needs? Can the funds be used to purchase tablets or software that manage a school security program, software program? Would this cover CPR training? We don't have a registered nurse, but a health coordinator. What about licensed counselors? So these are some questions that came out of last week's session. I'm sorry, it just got loud in my office. And we'll add to this list as you ask questions today. So let's go over the grant information guide. I'm sorry, I'm just going to pause for 10 seconds and move locations. Excuse me. Okay, thank you all for your patience. It just got a little loud where I was sitting. Okay, so we're going to go over the grant information guide. Now, let me pull that up on my screen. And it's on the webpage on the left-hand side right here. And this guide provides all the information you'll need to know as an eligible school. Sorry, my computer's taking a minute to load the document. Here we go. This is what it looks like. There's a table of contents at the beginning to guide your reading. There's a description of the program. If you'd like to know where the funding is authorized, it's coming out of the JCR report for the operating budget for this current fiscal year, 2024. You can see pages 263 and 264 if you want to read what the authorization says. There's a link to our webpage. As a reminder, the purpose of this program is to provide funds to non-public schools for school nurses, other health professional services, and for school security. This information was released on August 1st. Applications for interest are due by September 15th, and reimbursement requests have to be submitted no later than October 16th. The grant period is July 1st, 2023 through June 30th, 2024, and there is $2.5 million available. Any funding that is not obligated out of this program, that is any schools that do not wish to use their funding or that don't apply on time or don't submit invoices for the remainder of their allocation, all remaining funds will be reverted to the non-public textbook program. And that application will be released around October, later on this year and around October. So any remaining funds will be pushed to that program. So how do we determine the school allocations? Award amounts are calculated in the following manner. We have a list of 171 eligible non-public schools. Only schools that participated in Boost the last school year, the school year that just ended, are eligible to participate in this program. So we have 171 non-public schools that are eligible. Half of the funding available, that is $1.25 million, we dispersed by providing every school with a base award of $7,400. So every school gets that base award. And the remainder of funding is determined by equally dividing those funds among schools based on the total student enrollment that you reported on your non-public textbook program application for 2022. That's how we determined the school allocations. I'm the program contact for this program. The email address for this program is grants.msde@maryland.gov. Please direct all questions to that email. There are several of us that man that inbox, so if I'm out, there are other staff members who can step in my absence and answer questions. So what can you use the funds for? I'm sure you're all, this is part of the reason why you're here. We have this money, what are we allowed to spend it on? Funds for this program are dispersed via reimbursement. So you, the school, sends us an invoice requesting reimbursement for costs that you've incurred or contracts that you've signed with security companies or healthcare professional companies or staffing agencies. The reimbursement requests have to align with the use of funds in this section. So you can ask for funds to purchase goods or services. Goods, for those items, it's necessary that when you send us an invoice for the items that you've purchased, that you attach receipts to that invoice to evidence the expenses that you've incurred for those goods. For services, schools can engage in a contract with a school nurse, other health professional through a medical staffing agency, or your current employees that fall under this category, as well as security officers. The contract that you sign with that agency cannot go beyond June 30th of next year. So when you submit invoices to us by October 16th, if you can supply a contract that says that you're obligating your funds through the rest of the year, then we'll take that contract and set your funds aside for you to invoice for the remainder throughout the year. And there were some questions about this, so I'll give you some time to ask questions at the end. And if you have questions about the timeline, we can clarify at the end of this presentation. So funds can be used within three main categories. First, for school nurses, you can use funds for the salaries for nurses, staff, medical training courses, or medical supplies when accompanied by the request for salaries for that school nurse, or to accompany medical training courses for staff. Funds can't be used for furniture for the health suite. Funds can also be used for other healthcare professionals. This is a category that's specified in legislation. So you can use funds for salaries for other healthcare professionals, such as psychologists, counselors, psychiatrists, social workers, OT, occupational therapists, physical therapists. Someone last time asked about cognitive, educational, intellectual testing for students. You could use funds for that as well. And salary, supplies and materials for these positions when accompanied by the salary for that position. Funds cannot be used for the furniture for that therapy area. And under security, funds can be used for salaries or stipends for security personnel, either that you currently have on staff or that you seek to hire or contract, owned or leased security equipment, or software on a case-by-case basis. If you have any questions about a specific item or product, it's best just to email us so that we can talk about whether it be allowable or not. Generally, security equipment that would be approved that does not require construction to your building or rewiring your building. You can also use these funds for low-cost, non-capital school safety upgrades, again with MSDE pre-approval and price quotes. So funds cannot be used for capital improvement and construction. However, if there are security upgrades that your school building needs that are not capital improvements, that would be covered. So such as getting new locks for your windows, outfitting your current windows with a new locking system would be something that would be approved. Staff security training courses, camera surveillance system, and installation of that system, fire alarm replacements or new installations, again, window locking hardware, security system installation, things like that. Funds cannot be used under security. Funds can't be used for capital improvements that would alter the structure of the building. So, if you say that your roof is old and needs to be replaced, and you say, well, it's a security issue because the rain someone could fall in through the roof or something, that's something that would fall under not approved. Projects and spaces primarily used for religious instruction or worship. Projects and buildings used primarily for administration. So if you have a building that is strictly for office staff or central staff where instruction is not taking place, projects in those buildings would not be eligible for the use of funds. Projects for improvements to temporary or portable classroom buildings, expenditures to supplement an approved state allocation for a project. So this is if you are participating in the non-public aging schools program and you have a project that's being funded through that program and you want to use a part of these funds to supplement that project, that would not be allowed. Design, construction management, project management, testing or inspection fees, salaries or wages paid to employees for project work, general maintenance such as painting, repairing equipment, patching roofs, or indirect costs as well. So I think I'm actually going to pause here because last time there were a lot of questions about the use of funds. So if you have any questions about this, can you please unmute?
Hello, my name is Janai from TCS, and I have a question about the use of funds for the healthcare professionals or health services. So one question I had was about eye and health screening, like eye testing, like vision screening. Would we be able to use the funds for vision screening or any other health screening? Like for if the students need glasses. Okay. And I also wanted to know if we could use the funds to pay for healthcare speakers, so people that will come in and speak about important health issues.
I'm assuming that would fall under staff medical training courses.
Okay. Yeah, I just wanted to clarify if speakers who spoke about like any health issues or were educating the students about health issues, if we could pay for them with this one.
So I'm trying to picture what you mean. So the funds can be used for medical training courses for staff, but not for students.
No, not for not to train the students, but if we had speakers who specialize in a specific healthcare field, if we had them come in and talk about their healthcare field or a specific health issue, like for example, if there was a doctor who specialized in COVID and they came in and talked about COVID and health procedures and, stuff like that.
So it's best to send us an email if you're not sure. I can respond to you offline. I have to talk to my team about that one, but generally, if it's a training course for staff, then it would be approved. If you're having a speaker come in to talk generally about a topic just for interest, then that doesn't sound like it would fall under this use of funds.
Okay, thank you.
Mm-hmm. Are there any other questions about the use of funds? I'm trying to see if there are more hands raised. I don't think I see any.
Is the document that you're sharing on the screen available for us as well?
This document, yes, it's on the webpage.
It is. I
So if
couldn't
you go
locate
back,
it. Yeah. Could you show me?
sure, it's right here.
Oh, perfect. Thank you. Awesome.
You're welcome. Sure.
And then for if we have a school nurse already employed by the school, we can use this grant as part of their salary, correct?
Yes.
And is that documentation different than? Yeah, obviously, we're not entering a new contract with someone. How does that? And maybe you already said it. How does it work that we submit that information?
We would just need, I'm trying to think, this question was asked before, and I thought we had something on here. So for current staff, you'll need to either, you'll need to develop a contract, or you can use their hire letter. We need some formal documentation that says, this person is employed in our school, and they're a school nurse, and this is what they do, and this is the length of time that they'll be working. This many hours per week through the end of, May 31st or June 15th or whatever the end of your school year is. That does not extend beyond June 30th of next year.
And then include their current salary as well?
Yes.
Okay.
Is there another hand raised?
Yeah, my question is on the same topic as the last one. Just since this is a reimbursement and someone's salary is paid out over the course of the year, will the school receive the full amount of the grant if we submit an employee's contract for the year? Are we going to get which is, their salary is greater than the amount of our allocation? Will we receive the full amount of our allocation as soon as that's processed, even though we're going to be paying the staff member over the course of the year?
So to obligate your school's allocation by October 16th, you can send to us the contract for the school nurse, or for the total over the year that person is being paid. So us receiving that contract obligates those funds for your school, and we set them aside. We don't revert them to the non-public textbook program. Throughout the course of the year, from November all the way through June, the school, you can send us monthly or quarterly invoices for the hours that school nurse worked that month or that quarter, and request that we reimburse you for those salary expenses. You can, I guess it's up to you whether you'd like us to, since you're saying that the funding allocation that you're allowed doesn't pay for that nurse's entire salary. So you could have us, these funds go for a portion of their salary every month, or if you'd like to just exhaust your allocation for this grant, you can use these grant funds to pay for their salary, all of their salary for, November, December, and January, and then you've exhausted your funds. Does that answer your question?
Yes, thank you.
Okay.
Excuse me. I have a
Okay, so, oh, yes.
I just wanted to and clarify on the security part of the grant. The visitor monitoring and management station, does it necessarily just have to be with the security guard, or could it be from the welcome center, where the parents come into the school, and that's the first point of contact with staff. So we're looking to, we have a concrete wall that we were looking to put a window in there, and then have a sliding door. So basically we would be able to receive the parents on the outside, but stay inside and keep the parents from coming inside.
So I'm not sure whether you're asking about the welcome center surveillance check-in software system, or blowing out a part of the wall and installing a window.
I'm not
sure which
one. I'm asking about, the construction part of it, or would the grant cover that part of it? Taking out, cutting the wall, putting the window in there, putting the monitoring, station in there. It wouldn't be security monitored from, a security guard, but it would be the secretary's receptionist area where they meet the parents and they come in and, check out those students, bring them in, bring them out.
Yeah, so we can send me an email about that.
Okay.
I have to talk with some other staff members to determine whether that would be allowable. It sounds like a construction, like a capital project that would alter the structure of your building. If you're opening up a wall, you'd have to check to see whether that wall is load bearing. So that construction part of that project doesn't sound like it would be approved. But if you're purchasing a software program and the tablets that kind of flip around, you've seen those cashiers use them, flip around to the customer, where the parent can fill out a health survey or sign in to the school, that software and hardware would be approved.
What about with the so after we've opened up the wall and done the construction part of it, the window and the speaker system, that kind of, would that count?
So you're saying you'd find other funds to pay for the demolition and opening up the wall, and then have us pay for the what?
So it would be like the window, the monitoring software. I mean, to monitor, the camera outside the room, the software to go with that, the locking system.
It's best just to can you send me an email
I will.
about specifically what? Yeah, I need to think about that. But the security system that you're referring to sounds like the second bullet in this list, which is owned or leased security equipment or software. But yeah, it's best just to send us an email about that.
Absolutely.
Just so we can,
Thank you.
yeah.
I have a quick question. What about updating an intercom system so that all classrooms would be able to get proper notification if there was an issue or something like that?
Let me see. Would that fall under surveillance system? I'm trying to see what that would fall under.
Or visitor monitoring and management, possible?
Visitor monitoring. I can see that.
Okay. Or camera surveillance, the same thing. It's just,
Yeah, audio surveillance or camera surveillance.
Yeah.
Yeah.
Okay. I mean, I can send an email too.
Yeah, just so we can give you the best guidance.
Sure. Thank you.
Yeah. Bob, make sure you're writing down all the specific cases, so we'll add them to the frequently asked questions as well. Any other questions about use of funds? I'm looking at the chat box. I don't think I think there's no other questions. Okay, so I'm going to move on from use of funds. And if something occurs to you later on, we'll save time at the end for more questions. So the application, I'm going to dive into that in just a second. Here are the reporting requirements. This is the October 16th, actually, is the last day that schools can submit invoices to MSDE for a request for reimbursement, and the last day that schools can submit signed service contracts to obligate funds for services that align with the allowable use of funds. Here's a general timeline of events. On August 1st, this information was released. On August 3rd, 8th, which is today, and September 12th, we're holding a virtual customer service session. On September 15th, the application for participation closes at 5 p.m. And then October 16th, a month later, the deadline, that's the deadline for schools to submit requests for reimbursements and service contracts. And the grant period ends June 30th of next year. Information about our customer service sessions, which you all are on right now. And then two appendices. Here is the list of schools that are eligible this year, as well as their their funding allocation. And there is also, excuse me, the sample, a PDF of the online application, so you can preview what it looks like before diving into it and filling it out. So let's just go to that now. So the link to the application, actually a faster way to get there is just through the web page. The link to the application is in two places. It's in the center, and it's also on the left-hand side under the grant information guide. Okay, I've already completed it. I filled it out already. Let me try this again. I filled it out during the last session as a school to demonstrate. Can you all see my screen?
Yep.
Okay, it has the online application pulled up. Okay. So when you access the application, the first page provides, again, just a reminder of the background. You'll scroll down and click on the blue arrow. That leads you to the next page where you're asked to select the name of your school from the list. So I'm just going to choose Bishop McNamara High School, just as a sample. And then next you have to answer the question, do you wish to participate or no? If it's no, that means that I'm sorry for the notifications. If you say no, you're opting out, that's fine. This means if you check this box, you're understanding that this means you won't be eligible to spend down the funds that are for your school. But for the purposes of this training, I'm just going to click on yes, our school is participating. And next, we'll be asked to provide the address and phone number for your school. So I'm just going to put my school's address here. If there's no address to, just put NA, city, the state, and the zip code as well. So click on the blue arrow again and designate a primary contact for your school. All communication about this program will go to the person's email that you designate here. So if it's your principal, that's fine. If it's your school secretary, that's fine too. But the person that you enter as this point of contact should be accessible, should be easy to read, should be someone who checks their email often. It shouldn't be someone who's going to be retiring soon. So you'll enter your point of contact here and their email address as well. And a phone number where we can reach this person. We'll click on the blue arrow. And all grant recipients for these funds, we have to have an updated W-9 on file for your school. So you will, I'm just going to locate a PDF document here. So you'll upload your school's W-9 and go to the next page. Here's a list of assurances that you have to agree to accept these funds. Maryland has follows the 2 CFR, which is the Code of Federal Regulations for that guides our financial reporting and use of state and federal funds. This is a state program. And there's also a link to the Maryland Financial Reporting Manual, which is what Maryland as a state has adopted. So those links are here as well for you to preview. So you're attesting here that all the information is factual, that all the funds distributed are subject to state and federal laws, that you will not invoice us for anything obligated before the grant period, so prior to July 1st of this year, which you've already received reimbursement for. You understand that as a recipient of these funds, you must adhere to the uniform administrative requirements, cost principles. This speaks to items such as retaining supporting documentation for items you've purchased, receipts, packing slips, payroll records, inventory lists of supplies and materials, again, payroll lists, contracts for personnel. And you understand that invoices and all the accompanying documentation must be kept on file for 3 years in the case of an auditing request. So you'll agree to all of those assurances. You'll click next, and then that's it. You have completed the online application indicating that you're interested in participating. We'll receive a notice, and I think I also have this set up for you to also receive an email verifying that you've submitted an application. So that's the online application. So let's say you've completed the online application and you're ready to start receiving reimbursement for things you've purchased. You can send MSDE an invoice as frequently as on a monthly basis and as infrequently as on a quarterly basis. The invoice form, the template for you to use is on the left-hand side of this web page. And if you click there, it's going to download to your computer. So I'm going to open up that document. And it's an Excel form. It's an Excel format. So here's all the information that we'll need to process the invoice. You'll have to enter the date of the invoice. Let's say I'm processing this, let's say today, August 8th. The invoice number. This invoice has to be on your school letterhead or have your school logo at the top with your school logo. Here's where you enter the line items that you're requesting reimbursement for. You must first select a category of expenses, either school nurses, other health professionals, or security. So if you're using these funds for a school nurse, let's say just for example, then the item description would be school nurse, hours, let's say for the month of September, all of the month of September. And that school nurse worked 25 hours a week times 4 weeks in the month. And that school nurse earned $45 per hour. That's your calculation. And then you'll enter the total here. 25, I use Excel for formulas. 25 times 4 times 45. So you're requesting a reimbursement of $4,500. And the supporting document that you attach to this invoice will show that that school nurse worked 25 hours a week for 4 weeks in the month of September. You can also, add additional lines. Let's say if to accompany that school nurse's position, you ordered school supplies from your medical supplier. And the calculation, let's say there are hundreds of items that you purchased to start your school year off, and it would be too long to list in this invoice form. You can say, see attached list. We'll accept that, see attached list, and let's say that list totals $5,678.51. We'll accept that as well, provided that you also attach that list of items that you've purchased. So this invoice is totaling $10,178. You'd have your convert this to a PDF, have your head of school sign it, and then attach supporting documents that demonstrate the expenses that you've incurred for the month of September. For a sample invoice, there's one that's been completed and it's on the webpage as well. This is for logo name school. It's a generic invoice, just a sample of what you can of what we're looking for item description and calculation in total. So there's a sample for you. I think that's all the information I had to go through. I think that's it. So I'd like to stop talking and give you all time to ask any additional questions you have.
Nicole, I have a question about Boost. Can I stay on the line and ask you that after this?
Sure.
Okay, thank
Of
you.
course.
And Nicole, I just sent you an email. We have multiple listings on the website or in the drop-down tab for St. Mary's. So I'm just wondering and clarification on which one St. Mary's Annapolis is.
Do you know your advanced link number?
I don't.
Is the drop down, does it only say St. Mary's, or is there an advanced link number next to the drop down?
There are advanced links next to the drop-down, but there's multiple ones, and I'm just not sure which one we are.
Okay, sure. You said you emailed me about it?
I did. I emailed the one in our messaging.
Okay, great. Thank you. I'll respond to that.
Nicole, thank you.
Sure. And for the future, we're trying to use that advanced link number as often as possible, especially for the St. Mary, St. John, St. Joseph's of the world, so that we don't get things mixed up. We want to make sure you're getting what you're supposed to get. So when I send you that information, just make a note on a sticky note or somewhere. That's your advanced link number.
I will put it on my wall. Thank you.
Thanks. And Dr. Payne?
Yes, good morning.
Good morning.
I need to clarify the statement you made relative to the invoice on our letterhead. Did you say that, or am I sleeping?
Yes, ma'am. That's correct.
Okay, so can you say a bit about that? I'm not clear. If I purchase, so whatever invoice that I would receive, let's say from a vendor, I would have to transpose to our letterhead to send to you?
No, the invoice form that you fill out is your way of asking us to send you money. So that invoice form has to have your school letterhead on it. It has to have your school letterhead so we know who it's coming from. So it is designated as this is for St. Joseph Regional School. Here's their logo, here's their letterhead, here's their address. We know exactly who the invoice is coming from. If we're audited and they ask us for records and they pull up an invoice without a logo on it, they say, who's this from? What school is this?
Okay.
That's the reason.
Thank you.
You're welcome. Sharon asks, to whom do we submit our invoice? Not sure. I think that's in here, but if not, we'll add that information to the web page. You'll send your email, you'll send your invoice via email to grants.msde@maryland.gov. You'd send your invoice directly to that email address. If you have any other questions, please feel free to just unmute and speak up. Talia says, I don't think I received a copy of our submitted application. FYI, as you mentioned, you thought this was set up to go out. Yes, Talia. Let me double check the setting on the online application. I I realized that after the last customer service session. So if you applied really early, like as soon as it came out, you probably didn't receive an email copy of your responses. But if you send me an email, then and you want to like triple check to make sure we received your application, send me an email and I'll respond and confirm. You're welcome. We'll update the list of frequently asked questions on the webpage. We'll put a recording of this session up there as well, as soon as we have closed captioning finalized. So I think I'll end it here. And if you have any questions, call or email. In the meantime, I'm going to stop recording. And if you have any questions about programs that are not health and security, then I'll stay on the line as well. And thanks for joining, everybody, and asking great questions.